we were talking to Dr. Emily Chang, and I know that name sounds familiar. She's been hanging out with us on occasion for 5 years now, going back to the dark days of COVID back in 2020. Dr. Chang, good morning. It's wonderful to speak with you again.
Good morning. Great to be here again, too.
Yeah, so we kind of started our odyssey together. This is your eighth appearance on the show, so I really thank you for that because I know you guys are always busy in the medical field. And we were just hearing about the lack of personnel that a lot of hospitals and health centers are having from Dr. Sharon Weinstein, who is the head of the Academy of Nursing. She's a fellow with the American Academy of Nursing, so I know how busy you guys are. So we're going to talk about kidney health today because you're a kidney doctor, and we were kind of kidding around during the news, and I mentioned this a little bit earlier. Nephrology. I don't know. There's something about that word. It sounds like it should be associated with a movie around Halloween, like Doctor of Nephrology. But and you said, yeah, I don't use that word very often myself.
Yeah, that's right. I think the word is a little confusing sometimes to my patients because they get it confused with either neurology or necrology. And I suppose if I was in a scary movie, sometimes my patients are a little scared when they walk into the room until I calm them down. So I guess it could be a scary movie.
Yeah.
But I often call myself a kidney doctor instead of a nephrologist because it's easier to understand.
Well, as long as your nurse doesn't say to the patient, come with me to the laboratory, you'll be okay.
Yeah.
Yeah. So you're over in Chapel Hill, Burlington, Sanford, South Carolina. You've really worked with patients in kidney disease. And it's a little scary because we are so dependent on our kidneys. They are our filtration system for our entire body, right?
Yes, that's right. I mean, they work so hard every day and at night while you sleep. They are constantly working. So you have to treat them right.
Indeed, indeed. One of the things that I thought we would kind of start off with, and you have some tips for drivers out here too, um, and this may take just a moment to explain, but when you put your hand over your heart during the Pledge of Allegiance, that's not really where your heart is. It's more in the center of the chest. And when you got this aching back and you've been doing some work maybe that you haven't done before, or you stretched a little bit, or you picked up something wrong, and you go, oh, my aching back, and you put both of the palms of your hands on that soft portion between the ribs and, say, the hip area, and you've got that little fatty area. That's where the muscles are. And I asked you, is that really exactly where the kidneys are? And your answer was, that's exactly where the kidneys are. So the question then becomes, and that you kind of pointed up a little scared because there's always some confusion. Is it muscle? Is it kidney? How do I tell?
Yes, and that's a very common question I get. So let me just be very precise because I like to be more exact. But on the
Take
right
your
side,
time.
it's probably right where your kidney is. On the left side, it's probably up a little bit higher, just to be precise. But yes, the kidney sits behind your muscles there. So it can get really confusing to patients when they have pain there, especially patients who know they have kidney disease. They're always calling me worried. Is this my kidneys? Is this my kidneys? I don't know. I slept funny, but could it be my kidneys? And I kind of go through a several-step process in my head. First of all, what's the cause of their kidney disease? If their chronic kidney disease is from diabetes, high blood pressure, as we've talked about before, worsening of your kidney disease actually does not cause pain. So if your kidneys are just kind of scarring more, there's no nerves inside the kidneys. There's only a capsule outside of it, and when that is stretched because of swelling of the kidneys or infection or a stone, then you can have pain. But if your kidney is just kind of slowly getting worse or even an acute injury, that's not pain-inducing. So I first of all think, what is the cause of their kidney disease? The next step I go to is it someone who periodically gets stones? Because stone pain can be very sharp, severe, It needs to be treated if it's causing pain. So I ask about the nature of the pain, if they're prone to kidney stones. Another thing I consider is if they have a specific disease called polycystic kidney disease, which I take care of a lot of those patients. We have a polycystic kidney disease specific clinic. And in that disease, the kidneys get really enlarged because they have lots of cysts growing in them. So for those, if you're one of my patients who has that disease, then I'm more aware that it could be an infected cyst or cysts expanding. Sometimes those patients have pain that just comes and goes. So I go through all of that in my head, kind of ask the patient questions about, has there been anything recent? Did you sleep funny? Did you work in the garden? Were you driving a long period and didn't get up and take breaks? Things like that, and that could suggest more of a musculoskeletal thing. So 9 times out of 10, it really is a musculoskeletal, but I always want to make sure you're not that one that has some kidney issue that I need to take care of.
Wow, yeah.
One of the things I wanted to ask you, Dr. Chang, good morning to you, by the way. I was curious of how much time when you spend with a patient do you spend making them aware of how the kidney actually functions? Because a lot of what you're talking about is teaching the patient to be able to read his or her own body, to get a sense of how that body works in time and space, so that when events do occur, they actually are not able to self-diagnose. We don't want them doing that. They're not doctors, but they're able to kind of point to what they're feeling and specifically be able to articulate that. I tell you what, I'm going to let you marinate on that question. We're going to take a quick break here. We're going to come back on the other side of it. You'll be able to answer it then. It's the Dave Nemo Show. Go to radionemo.com, go to YouTube, and subscribe over there as well. We'll be back after these messages with a timestamp and then a Highway to Health conversation with Dr. Emily Chang.
Remember that Hotels for Truckers members get instant discounts at American Inn Comfort Suites, Days Inn, Econo Lodge, Motel 6, La Quinta, Microtel.
The Joshua Chamberlain Society is unlike any other veterans organization. It's truly a family, and I know that firsthand from working with them myself. Their mission is to make wounded veterans and families of deceased veterans feel the support and appreciation of their community for life. Our veterans' injuries are permanent, and so is the JCS support. From monetary assistance like paying utility bills or college funds to helping our heroes find purpose, JCS is a family that surrounds and supports the heroes who have sacrificed so much. Learn more and make your donation at chamberlainsociety.org. That's chamberlainsociety.org.
Are you on the hunt for the perfect place to recharge after a long day or week on the road? Look no further. Hotels for Truckers, designed by truckers for truckers, provides free membership that unlocks access to deep discounts and spacious tractor-trailer parking at thousands of popular hotel chains nationwide. Enjoy incredible discounts, earn valuable points, and enjoy a great night's rest. Download the Hotels for Truckers app today and make your long hauls more restful and affordable.
I've heard the wail of a galloping gale on the road to the Florida Keys. I've felt the roar of a thunderstorm on the Oklahoma seas. I've set my sail on the Oregon Trail. I've camped in a redwood stand. I've loved the best and I've hated the rest, but I've trucked all over this land. I've trucked all over this
While you're trucking all over this land, you're probably looking at the clock. It's 7:16. It is 16 after the hour here on the Dave Nemo Show, and not only will we help you manage the time, we can help you manage your fuel by going to the multi-service fuel card. They provide quality customer service, generous lines of credit, and a nationwide network of fuel-saving truck stop locations. NeverRollAlone.com is where you want to go. We are back to the Dave Nemo Show's Highway to Health segment. It's brought to you by Hotels for Truckers. Go to hotelsfortruckers.com and find out where you can get that app to get yourself settled in for the night and getting the rest that you need. Dr. Emily Chang has returned with us. It's good to have you back. I did give you a question. Do you need a primer, or do you have an answer for us, Dr. Chang?
I'm ready.
Fire away.
So education is actually a huge part of what I do. And so I told you at the beginning, I tell them I'm a kidney doctor, and I sometimes say I'm not the surgeon kind, I'm the medicine kind, which means we do a lot of talking. So it's kind of a mix during the visit of I'm gauging what kind of education they need. So different patients need different education. Some patients are really into labs, and they really like to know how to interpret their labs when I draw them, so I need to do a lot of explaining what all the labs mean. Some patients really want to know what each and every medicine is doing, so I need to explain that. Some patients really need to know about the symptoms to look out for. But I think in general, for all of them, I try to give a base of what it is your kidneys are doing and what it is I'm looking for in your labs, which is basically a blood and a urine test, and how that helps me determine your kidney health.
One of the things, Dr. Chang, you mentioned earlier is we used the phrase kidney disease. And then, and I kind of knew this, there is no kidney disease but under that umbrella are a lot of different things, and you mentioned a couple of different ones. Is there a checklist in terms of, can we call them variations, how many variations there are? And I'm sure there are combinations of some of these things as well.
You're right. Kidney disease is a catch-all for anything that affects the kidney.
Like heart disease.
So
it could be
things.
Your aorta.
Yes.
It could be one of your veins or vessels. Yeah, gotcha.
That's exactly right. Like heart disease is a catch-all. Kidney disease is a catch-all. It can include stones. It can include kidney disease from diabetes. It can include this polycystic kidney disease I told you about, a bunch of autoimmune diseases. So lots of things. The list is very, very long of what can cause kidney problems, and it's all classified under kidney disease.
Got it. So some are basically life-threatening. Others are just a pain, literally, right? I've had the stone, so I know that pain. Pain you never forget, for sure. Yeah.
And some are silent. There's no symptoms, and the only way you know is these tests. And those are the ones that are scariest for me because they can present very late stage because they had no idea until late. So those are the people we're trying very hard to catch early to prevent them from getting to that point.
Dr. Ryan Zimmerman was with us last week from Baltimore. He's a hand surgeon at the Curtis National Hand Center at MedStar Union Memorial Hospital there in Baltimore. We talked with him about carpal tunnel syndrome, especially in terms of the vibration of the steering wheel of these trucks that drivers are, holding on to for 8 to 11 hours a day or night. And then before that, we had a discussion about cancer, of the prostate cancer, and the case. It seems as if right now this is so-called whole body vibration now is really bearing down, no pun intended, on the prostate gland of truck drivers, and they have a 40%, 4 times more likely to get prostate cancer than the general public. Vibration in those trucks obviously has an effect on the body. What about the kidneys?
I haven't heard, but I bet you if it's got kind of effects on other body parts and cancer-causing things, it certainly is a risk. I mean, when you bounce a lot, I think that your cells are sort of activated, and it may cause them to get inflamed, and inflammation leads to things being released that sort of sets off different cascades. So certainly I think it would need to be considered. I don't know if the data is out there yet, but yes.
Sure. Yeah, I guess it kind of stands to reason in a sense, but I'm glad to hear that you haven't heard much because that's good. No news is good news in this regard, I would imagine.
That's true. I mean, there's certainly lots of things truckers are at risk for regards to the kidneys, and I hate adding more, but yeah.
I was going to kind of follow up that question with the idea that, we joke about this all the time on the show. We have no problem helping our listeners maintain their trucks. They are spectacular at it. They are able to keep up with all kinds of things on their trucks in order to kind of keep themselves rolling down the road. They don't often enough view their bodies as one of the tools that they need to properly operate the trucks. In regards to the kidneys, if you were going to give somebody just a simple primer of, here are some simple things you could do to make sure that when you come in to see me, we're having a more positive conversation than a negative one, what does that foundational conversation involve?
So Let me see, if I would say the top three things: drinking fluids, non-caffeinated and non-sugary fluids, is important. The other thing would be avoiding salt, which I think is huge for truck drivers. It's probably really challenging with the food you have access to on the road. And then exercise. So all these things are a challenge for people who work in this industry for obvious
Kind of the
reasons.
usual suspects too, right?
Yeah. But so people who have desk jobs, I can tell them, like, get a standing desk, stand there and do, every hour stand up and move around for 5 minutes. You can't really do that when you're driving. So like these little tricks I have, it's really challenging in this field.
One of you mentioned drinking non-carbonated,
Non-caffeinated,
non-caffeinated,
non-sugarated,
yeah,
non-caffeinated.
non-caffeinated. Okay, I get caffeine, but is caffeine a direct problem for the kidneys, or is it just part and
No,
parcel?
I think for me it's and in particular for truck drivers, is caffeine is a diuretic, so it's going to make you pee. And so it just makes sense if you're drinking it and it's making you pee, it's not really counting to hydrate you as well as water. I mean, you
In and
absorb
out.
some of it.
Yeah.
Yeah. I mean, some of it gets absorbed, but it just doesn't work quite as well as water, which a lot of it will get absorbed, but caffeine will kind of make you pee out more than you would normally. So it's okay. It makes you pee more, which is a hard thing when you're driving too.
Well, yeah, I know, and that's why I always hate to say drink plenty of water out there in those trucks, because I know that, and I have a bathroom down the hall. You do too, and drivers don't. We have the pee bottles and things like that. I'll never forget the first time I rode with a driver. It was after midnight. We're about 2:00 in the morning, and this is when I was on the air, from midnight to dawn on the AM stations, and man, he just unzips his pants and I went, what the heck is this guy doing? And he gets his jug and pees in the jug, which is what you got to do, because if you hold that too much, obviously your bladder is concerned. Does that affect your kidneys as well? Oh, overhydration, I guess you might say.
Yes. So
Thank you.
those are my counterpart doctors, the other kidney doctors that take care of that. But it is an overlap, and I like to say if their part is not taken care of, it can affect our part. So same thing as like a enlarged prostate, which a lot of older men as you age tend to have. It's like a stopper, so the fluid can't get out of the bladder. And it's similar to when you overhold the bladder. The urine can, if that gets severe, back up the tubes to the kidneys. And if that happens, that can cause swelling in the kidneys. And if that happens, that pushes on the cells of the kidneys, which means they don't function as well. So that's a very extreme circumstance. But if this happens over time, over and over and over, I do worry about that kind of slowly affecting the kidneys. So
I guess,
I
don't want to go
want
graphic
them to
here.
do their job.
I guess if you can hold it that long, you might be in the Guinness Book of World Records anyway. If you're holding it long enough to actually harm your kidneys, that's saying something right there. That's some willpower, right?
Well, some of it is like people's nerves in their bladders get stretched over time. They don't work as well, but that does allow it to expand, but they may not feel it so much. And so you just don't feel it. And there it goes up to the kidneys, and there's a problem. I mean, it doesn't happen that much. But that's an extreme circumstance, and it's one that I worry about.
I'm going to go off on a tangent here just for a second. Dr. Emily Chang is with us here this morning. She's been part and parcel of Highway to Health since 2020. Absolutely incredible that she's stayed with us all of this time, and really appreciate you being on with us as always. But one of the things I'm kind of asking now, the kidneys and the liver, they are both cleansing mechanisms. Those are your cleaners, right?
Yes.
Is there a confusion between who does what, and do they work together?
There's not confusion. They have their roles pretty well sorted out. I would say kidney does more of it, kind of the bulk of it. And I'm not just because I'm biased, um, but it is important. Like, so pharmacists are really important and helpful in our jobs, specifically for certain patient populations who take certain kinds of drugs. And they always are looking up, is it primarily cleared by the kidney? Is it primarily cleared by the liver? Because that's real important, especially if they have kidney problems or liver problems, how that medicine's going to be dosed. So that's one area where it's big for us. But there are some things that are cleared a little bit by both, some things only by the kidneys, some things only by the liver. But you yourself, the patient, a person doesn't need to know that unless you're taking specific kind of drugs, and then your pharmacy and medicine team needs to be aware of all that.
Got it.
Dr. Chang, really quickly, and we can answer this the next time you join us again. How do you monitor to make sure the medications that you've prescribed are actually working the way you want them to, and also how long does it take before people start seeing results on medications that you give them?
It really depends, and some of it is sort of my gestalt over the years, my experience. And so a lot of the medicines we prescribe are blood pressure medicines. So we do really, there's for patients who have blood pressure problems or kidney disease, we've really been advocating for people to get blood pressure cuffs at home and teaching them how to take their blood pressure right, because it helps them to track and to see when a drug is having an effect. And it varies anywhere. It can have an effect from days to weeks, and what effect you're talking about varies too. Like, some will cause changes in your blood tests, and that could change in a couple days, but the blood pressure effect could take weeks. So it definitely varies. There's some medicines I use just for symptom management, and if there's no relief from the symptom in a couple weeks, then I just say stop taking it. That's kind of pointless. But I mean, I would say on the range of days to weeks it takes in general is what I'm looking at for effects of medicines.
And with that, we have actually brought the truck into the truck stop. Dr. Emily Chang has been with us, a regular contributor to Highway to Health on the Dave Nemo Show. Thank you. It's nice to meet you, too, by the way, Doctor. Thanks for giving us the time today.
Lovely to meet you, too. I always love coming on here.
Thank you so much.
Friends.
We will ask you back for sure. Dr. Chang has
Wonderful.
clinics in Chapel Hill, Burlington, and Sanford, and she's a Tar Heel to the bone.
Big thanks to Hotels for Truckers. Go to hotelsfortruckers.com. We'll be right back on the Dave Nemo Show.